Pathology. The morbid conditions at the point of ureteral obstruction require no detailed description. The strictures, adhesions, etc. present no peculiar features. The Hydro Nephrotic Sac. The tumor may consist of only a part of the kidney, whether because the kidney possesses two ureters, only one of which is blocked, or because a single calyx becomes occluded by a stone. Either condition is very rare. As a rule, the sac consists of the entire kidney and its pelvis. The ureter may also be dilated. The size of the tumor varies from that of a normal kidney to that of a child's head. The sac wall consists of the renal pelvis and capsule. The kidney caps the tumor. The outer surface of the mass is irregularly ovoidal. The inner surface is irregular. If the hydronephrosis is small, its interior consists of the dilated pelvis and calyces, figure 98. If large, it is a great smooth-walled cavity crossed by fibrous septa representing the remains of the columns of Bertini, figure 39. The sac wall may be thin, but is usually tough and fibrous. Cartilaginous nodules have been observed in it. Renal changes. The changes in the kidney substance are interesting. At first, the kidney is congested, the canaliculi dilated, and the cells flattened. This process soon manifests itself macroscopically by the thinning out of the kidney tissue. Thus, the kidney becomes more and more spread out on the surface of the sac, with a great portion of its secreting substance atrophied. But this is not the only change. End note, there is no interstitial sclerosis, no production of fibrous tissue in simple, uninflamed hydronephrosis. The remaining parenchyma cells, for the kidney is never completely atrophied, undergo a compensatory hypertrophy. They grow to 3 or 4 times their normal size, and their secretory capacity increases accordingly. It is for this reason that every hydronephrotic kidney should be recognized as a useful, though and impaired, organ, and should not be sacrificed unnecessarily. The hydronephrotic sac may be open or closed. If the ureter is merely kinked, the hydronephrosis is usually intermittent. If contractured or obstructed, the hydronephrosis is fixed or constant, and the orifice of the sac may finally become absolutely sealed. The fluid. The normal kidney pelvis will hold from 2 to 8 cc's. A pelvis that will hold more than 10 cc's is dilated. The quantity of fluid in a hydronephrotic sac may reach 5 or 6 gallons. One case is reported, glass, containing 30 gallons. The quality of the fluid varies. A large, ancient, fixed hydronephrosis usually contains a simple solution of sodium chloride, though it may contain urea, albumin, urinary crystals, epithelial cells, and leukocytes, and less often blood or cholesterol. There may be a catarrhal pyelonephritis with slight infection of the contents of the sac, infected hydronephrosis. This light infection does not materially influence the clinical aspect of the case, but hastens the destruction of renal parenchyma. Physiology. The hydronephrotic kidney secretes a urine less rich in solids than that of a normal organ, but Guillain and Albaran have shown that even the kidney whose ureter has been occluded for a great while will begin to secrete when the obstruction is removed. Urea appears in the secretion, though it may have been entirely absent from the fluid in the sac. While the quantity of fluid secreted by the diseased organ is excessive as soon as the pressure of retention is relieved. In one case, infected, in which the renal tissue was so compressed that it was only 2 or 3 millimeters thick, the kidney excreted 1 liter a day after the pressure had been removed. The kidney whose outlet has not been entirely closed acts in a similar manner. While a normal quantity of urine may be excreted by the diseased organ, it is poorer in urea and salts. It usually contains 1/4 to 1/3 of the total urea. While the total excretion of urea may vary widely from day to day, this variation takes place almost entirely in the sound kidney, the diseased organ excreting an approximately constant amount.